I love this sentence because it's a sentence that I will tell everyone to remove. This is one of those sentences that I'm like, duh, right? Or BS. My name is Dr. Ryan Gray, and in this episode of PS or BS, I'm going to review a personal statement, give some feedback, and hopefully you'll learn a thing or two about how we review essays here at medical school headquarters and use that information to go improve your essay. Just a reminder, this is my opinion. There's no right or wrong way, maybe, to do a personal statement. And so use the information. If you think differently, you get different advice. Just know that there are many ways to think about this process, and I'll do my best in this episode to give my thoughts and also the reason behind those thoughts. Let's go ahead and jump in. All right. So right off the bat, super big hook. I'm not a fan of having hooks just to have hooks. I think a lot of times students go way overboard with the dramatic nature of their writing. But this one is a little bit dramatic. And it's like, oh, wait a minute. This is very personal. And as a 7-year-old, putting myself in a 7-year-old's shoes, it would seem like it might be impactful. So I'm super interested to see where this is going. All right. So when we look at where it is going, which is what I wanted to see next, we have lots of discussion around stigmas, around cultural barriers, and we don't have a ton about healthcare here, which is where I think the student ideally should try to focus on. Because remember, the goal is, why do you want to be a doctor? What experiences do you have that have led to, and in my opinion, that have led to the exposure to healthcare that makes you want to be a physician, or at least very early on here, we call it our seed, that made you want to explore healthcare. And then we end with this idea about trusting healthcare providers. Number one, I would refrain from using the term providers in any of your essays. There's a big debate and there's stigma with the word providers versus physician versus NPA. So use the word physicians as often as possible where it fits the best. But also the fact that there's this idea of that patients need to trust physicians. It's my general stance that we should avoid that sort of idea, because a lot of students in their essays will come off in their writing that they want to be doctors so they can be trusted. And there's a power dynamic idea there that for me, when I'm reading, is a turnoff. That it seems like the perception in reading these words is that the student wants to be a doctor to have power over physicians, to be the trusted one, to be put up on a pedestal. So I would try to avoid that sort of language. All right. And then we end here with a very common sentiment, right? I want the education. I want to be able to provide for people in a similar situation. The one piece missing here that I think is key is, how does this 7-year-old, 8-year-old, 9-year-old, whatever, as you're going through and growing older, how do you know that physicians are out there to help people in this situation? So to me, that's the missing piece. There's a discussion that the stigma and everything, and obviously the fear of being put in jail for addiction, for illicit substance use, the fear and the stigma and everything, they're staying away from healthcare providers, that word there. But there's no understanding for me as a reader that the student has experienced the role of a physician in the care of people with substance use disorders and how that affects the patient, how that affects the family. So that's the missing dynamic that I think if we were able to figure out, if the student is, oh yeah, actually I did see that kind of stuff, and tie that in, it'll be much stronger. Just a couple notes on language, on word use. I'm a dummy when it comes to words. I'm not great with my vocabulary. I wasn't a voracious reader. See what I did there with that big word when I was younger. I read a ton now through Audible and listening to books. But when I read essays and personal statements, I like very simple words. So when I read this. I had a patient, Peg, which is great. Use quotations the first time you use a name. Make sure it's a pseudonym so that we know it's not a real patient name and no HIPAA concerns. I had to read this a couple times to understand what was being said here. I had a Peg, a 40-year-old woman who suffered from a stroke that robbed the left side of her body of movement. When you're talking to someone, would you ever say, "Oh, it robbed the left side of her body of movement"? That's just when I'm saying it out loud, it's even hard to say because it's not a normal pattern of speech that we would use. At least I wouldn't. And so I would try my best to dumb it down, so to speak, into what words would I actually say here, right? I would say, who suffered a stroke that left the left side of her body paralyzed. Simple, right? Easy to read, easy to say. So being able to use those words and use the language in a very simple way. And then we go through the rest of the story, and there's a lot about Peg here. And this is a very common thing that students, I think, do wrong is they use the patient encounter, which is the right thing, but they use it not to show themselves, but to just continue to talk about the patient. And so remember that we're using these patients, these experiences to highlight who you are and the impact that you have and potentially try to show compassion and empathy and other traits that you might think are important that you want to show without overly selling them, but be able to show who you are, show your humanity through your writing. And with this paragraph, it's just a lot about Peg, right? I listened as Peg recounted her day was normal, woke up in a helicopter, must have been incredibly traumatic. So a little bit of sympathy there. I reassured her that we would take the utmost care of her as her team. There's a nice compassionate statement. You can tell by the writing, the words that the student is choosing to use, that it is telling. Whenever we have I verbs, right? I reassured, I obtained. Where else? I listened. I had a patient. I began college. These are all telling statements. Versus, if we see here, seeing her physical and emotional struggle made me harbor a desire. That is telling. It's helping the reader understand what's happening. You're seeing her physical and emotional struggle, which is good. Not that she's struggling, but the writing in that way is showing versus telling, versus saying, I saw her physical and emotional struggles, right? Just that small little difference can make a big difference in the writing and how it's received. So the student here, again, it's overly focused on Peg and not enough on the student for me to understand who the student is in this situation. What is the student doing? How is the student acting? How is the student helping? What is that impact? Other than obtaining the vitals, reassuring her, which I think is good. Uh, Being able to try to highlight that a little bit more, I think would be better. And then we see that the last several lines here, which is two somewhat long sentences, get into some of the reflection and takeaway, which typically just one sentence for a takeaway is good enough if done well. So I want to be the one who could assess her recovery progress, determine if she was ready for the next step at rehab, and then at home with her family. Great. It's not really helping me understand why you want to be a physician because I don't know if this is super specific about being a physician. A physical therapist potentially could do this as well. So making sure that what we're saying aligns with being a physician. And yes, there's some cloudiness with and PEPA, et cetera, going on. And so just be careful there. This experience underscored my desire to be a provider. So again, there's that word. Let's get rid of that word. Use physician who can utilize expert level knowledge to treat diseases and illnesses. I love this sentence because it's a sentence that I will tell everyone to remove. This is one of those sentences that I'm like, duh, right? Don't you want all physicians to have expert level knowledge? So to me, this is not authentic. It's kind of cliche and it's like a obvious statement. Of course you want expert level knowledge. Now I will tell you, and the student that I'm providing this feedback to will hear this and potentially go, "Oh, yeah, that's exactly why I did it." Think, why would a student put this in here? The student is differentiating physician versus everyone else as the physician having expert level knowledge, which to me is not necessarily true. I think PAs have expert level knowledge in their scope of practice, and Ps hopefully have expert level knowledge in their scope of practice. So I think everyone is an expert in their arena, but physicians obviously have the most expertise because they have the most training, the most schooling, the most time taking care of patients with residency and everything else. So it's a very common way for a student to say, this is why I want to be a doctor and not something else. Oh, because I can lead a healthcare team. Oh, because I want the most knowledge or expert level knowledge in this case. So I would get rid of this sentence and use that previous sentence as, why did this experience confirm that I want to be a physician? Moving on to the next sentence here. All right, so we have a very common paragraph here that, again, I think we can just remove the whole paragraph. This doesn't help me understand why you want to be a physician. This is basically a paragraph that says, I really like to learn things. That's what this paragraph is. So I would probably just get rid of the whole paragraph. There's no interaction here. There's no empathy, sympathy, impact that I can understand. You're using this patient, Neil, as a way to show, oh, I was amazed by ECT and I went to go learn some more about it. And then again, focused on knowledge, right? Expert level knowledge, physician's depth of knowledge. You did use physician here, which is great. Yeah. And again, why physician versus PA versus NP? It's this depth of knowledge that can only be honed through residency training. Okay. There's too much emphasis on why physician versus something else, when ultimately, if you do your job correctly in just saying why this makes you want to go on and take care of patients, it's good enough. And yes, there are some blurry lines, but I don't think we have to try this hard to focus on why physician versus something else. So again, we have another example of using the patient story not to focus on the student, but to focus on the patient. So all of this is about the patient, her medical diagnosis worsened, caring for, and then we get into the statement here, right? Caring for Rita showed me how important it is to know every patient's condition is unique and stemming from multifaceted life experiences, blah, 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 blah. Right? Again, a very, yes, that's true, but an obvious statement. And I am a fan of removing these types of obvious statements from a personal statement and most of your writing, because it's it's just yes. And it's not really helping me understand more about you. I think students use this as a sales pitch to show, "Ooh, look, I understand medicine. I understand what my role is." When again, the goal is, why do you want to be a doctor? Not do you understand what being a doctor entails, which is what I think this is all about. I'm not sure what's going on here, right? I cannot imagine turning away patients with acute and complex medical workups like Rita. I don't know, right? Did I miss something where it says that she was turned away from care? It says her siblings, right, were not supportive, or her friends have maintained a distance. It makes it seem like Rita wasn't able to get care. Or is this just a statement of, look, I want to help everyone? Which again, yeah, of course you want to help everyone, especially at this stage of the game. So I'm not sure what that statement is for there. I desire to be their physician, someone who won't give up until I find a compatible treatment that works for my patients. Again, it's a little bit, remember the goal, right? I want to be a physician because, or this is why I want to be a doctor. Why do you want to be a doctor? This is how I want to practice as a physician. This is aspirational in terms of, I'm never going to give up. And again, a little cliche, a little bit corny for a personal statement. I would get rid of these really strong, I will not sleep until I find the diagnosis. For me to realize this goal, I understood that going to medical school is an inseparable aspect of my journey. I'm not sure what that means. And did you understand it, or do you currently understand it? So it's weird that this is past tense. So just making sure. So this paragraph again is missing the point, and the reflections are missing the goal of Here's a story. Here's a patient. Here's who I am in this interaction. And then the reflection here is how it has strengthened my desire to be a physician. All right. And then we finish off. All right. And we have the conclusion. The conclusion for me, very aspirational. What do you want to accomplish as a physician? So we're switching from why do you want to be a doctor to what sort of impact do you want to have as a physician? Very aspirational. And this does a pretty decent job. I think there's lots of recap at the beginning that we don't need. And so I would probably shorten that some so that we can dive a little bit deeper into the aspirational aspect of the student and the impact that they want to make as a physician. I will often ask students, like, think in 40 years when you retire, what do you want your patients to say about you? And that's a different way of getting to think about potentially what to write about in this conclusion. So overall, I think the student has the right idea of what a personal statement structure should be. The opening seed is probably the best part of the essay. There's obviously some authenticity in that opening story. The conclusion, probably even better than the seed. And then the stories in the middle, I think the student has the right idea to use some anecdotes, but refocusing what we're focusing on in the writing in terms of not just focusing on the patient, but focusing on you, using the patient to focus on you and show who you are through this process, show your impact through, show your authenticity and all of that stuff through your writing, with the reflections focusing on why medicine and not necessarily future thinking what you want to do as a physician. And then that one paragraph in there about just liking ECT and nerding out and wanting to learn more, I would probably just scrap that whole paragraph. So overall, good, needs a lot of work, definitely not BS, but on the way to being a good personal statement. Stay tuned for more PS or BS from our team at Medical School Headquarters. And if you're looking for some one-on-one advising on your essays, go check it out at medicalschoolhq.net.